Welcome back to Andersen Acres. We're here with little Twig today, who is only a few weeks old, but already a terror. And please do not fall off the back of the chair. Don't fall off the back of the chair, Twig. I love you. But we're here today to talk about something that is actually quite serious. As cute as Twig is, there are serious things to talk about. This is something that every rabbit owner, breeder, and backyard farmer really needs to know. I'm talking about pneumonia in rabbits. I know it doesn't sound dramatic until you've seen a rabbit struggling to breathe. Pneumonia in rabbits can hit hard and fast, and if you don't catch it early, it can absolutely be fatal. So, today we're going to go over what pneumonia actually is, how it develops, the signs and symptoms you're going to want to watch for, what to do if you suspect it, and more importantly, steps you can take to try to prevent it in the first place. I'm just going to move my arm so you don't fall. I know, you're crazy. But you're crazy. I know, but you're crazy. We love Little Twig. Little Twig is staying on the farm. That's Trunk's child, and I think it's a girl. Still a little too small to sex reliably, but I do think that Twig here is a girl. And also, I think that Twig is trying to leave. Twig, come on. So, we're definitely keeping little Twig. Boy or girl, but I think it's girl. Anyway, let's talk about pneumonia. First of all, why does this matter? Rabbits are prey animals, and that means they hide illnesses until it gets really bad. A lot of times, by the time you realize something's gone wrong, they're already on their way out. They're really good at hiding it. Really good. You think chickens are good at it? Meet a rabbit. Pneumonia is one of those conditions that sneaks up on you. It usually starts as something kind of mild, like snuffles. And snuffles isn't not a big deal. Like, it is a big deal. But you can deal with it. And normally pneumonia will start with something you can deal with. And maybe you don't deal with it in time, or you don't deal with it correctly. You might see a little nasal discharge and hear a few sneezes and think, they'll get over it. It's just a sneeze. Yeah, they might get over it, and they might not. Because if that infection moves to the upper respiratory tract and down into the lungs, all of a sudden you're dealing with pneumonia. Okay? Pneumonia is no fun. It's a whole different ball game. It is difficult and often fatal. Pneumonia itself is a lung infection, and in rabbits, it can be caused by a variety of different bacteria. Ultimately, it doesn't matter most of the time which bacteria is causing it because the result is the same. But sometimes it's also viral, and in the case of viral, well, antibiotics aren't going to help you that much. In most cases, in almost all cases, it's incredibly dangerous. Viral, bacterial, every once in a while, it's even fungal. No matter which version it is, it's not a good place to be in. So basically, the lungs fill with fluid or pus, making it harder and harder for rabbits to breathe. Don't fall into my shirt. Thank you. It's harder and harder for them to breathe. Hi. Other things that could cause pneumonia to flare up are basically inhaled irritants or parasites or even a weakened immune system after stress or another illness. That was Vodka's tail. Why he had to walk between me and the camera, I don't know, because he could have walked on that side of the living room. He figured walking between me and the camera, at least his tail gets on film. So basically, pneumonia is an infection caused by a bacteria, a virus, or some kind of fungus, maybe a parasite, maybe an irritant started it. Whatever started it, you now have a problem. Okay? So let's talk about the basic warning signs. Hi. There are two categories. Early signs, something's not good, not right, going weird, and then ones that are red flag emergencies. So the early signs might be some mild sneezing, watery or thick nasal discharge, really watery eyes. Watery eyes in rabbits aren't normal, okay? They might have matted fur on their front paws. So her little front paws, I keep hitting the mic because she's in the way. But if her little front paws had matted fur on the inside of them, right on the insides, on the inside edge of the paws, and there's some matted fur, maybe some dampness, that could mean that they're wiping their nose a lot. There could be lethargic, and they might not want to eat. Loss of appetite is pretty common with a lot of rabbit illnesses. The red flag signs, the signs that mean you need to do something right now, whether it's going to your vet or treating it at home, whatever capability you have to treat, these are the signs you need to do something now. It can't wait till tomorrow. If they have trouble breathing, you want to look for fast breathing, open mouth breathing, the sides of their body working really hard with every breath. So if you notice they're instead of the normal calmer, right? If you notice their sides are, that's not a good sign. Okay? That means they can't breathe. They're having trouble breathing. You need to deal with it. If there's any cyanosis, which is kind of a blue or purplish tinge around the lips or on the tongue. If their gums are discolored, if they're pale, or if there's a bluish tinge, hi. It tickles, Twig. Twig's like, yeah, but I'm just going to eat your hair for you. Okay, you need a haircut. Thank you. If they stop eating or drinking completely, they got to get to the vet. Or if they isolate themselves and seem like they're too weak to move. Okay, that's also not a good sign. If you see any of these signs, the rabbit needs treatment right now. Probably with a vet. If you are not well versed in rabbit veterinary skills, you're probably going to have to hit up a vet. Again, this is why we try to have a relationship with a vet who knows what they're talking about when it comes to rabbits before something goes bad. So what happens at the vet? How is it diagnosed? Well, they're going to listen to your rabbit's lungs, the little tiny little lungs. They have little lungs. Even an adult rabbit, like, lungs are very small. But they're going to listen to those lungs with a stethoscope, and they're going to look for crackles and some wheezing and some other abnormal sounds, things that just aren't normal. They're probably going to want to take x-rays to see any fluid buildup in the lungs. And they're almost certainly going to do a nasal swab because they want to find out which bacteria or virus might be involved. That doesn't always provide you the answers, but it's better to try. Because if you can isolate the bacteria or virus, you are much less likely to make a mistake in treatment. The most effective treatments do come after a culture and sensitivity test, which tells the vet exactly what's causing the infection and what antibiotic will actually work. So if they say they want to do a culture, say yes. Culturing to find out exactly what the bacteria is, so you're not just randomly throwing antibiotics at it, is better than picking an antibiotic and hoping for the best. That's one of the reasons why antibiotics are now pretty controlled, even for farm people, because people are just throwing an antibiotic at something, and if it's the wrong antibiotic, you're just making the situation worse. So if they want to do a culture, yeah, you want a culture. So what about treatment options? Well, pneumonia in rabbits is not something you treat at home with leftover antibiotics. You need a rabbit-savvy vet, either an exotic vet or a farm vet who knows rabbits, to get the right medication and the right dosage. That said, there are some treatments that are fairly common with rabbits. So antibiotics like Batro, which is my favorite for rabbit antibiotics, they seem to tolerate it pretty well. You might have anti-inflammatories to reduce lung swelling. That's a good idea because the swelling is uncomfortable and makes it difficult to breathe. So an anti-inflammatory to bring that swelling down is a good idea. If they're really struggling to breathe, you might need to do oxygen therapy, and you might even need to go past that and go to a nebulizer. This helps deliver the medication directly into the lungs. So not just, I can't breathe, but also here's some medicine. So that can help. And then you probably are going to have to do quite a bit of supportive care. I'm talking assisted feeding, fluids, and keeping them warm and calm. Even if it's an outdoor rabbit, you're probably going to have to bring them in for the course of treatment. And you're probably going to be up a lot of nights, keeping that rabbit breathing while their body heals. Now I want to talk about quarantine, because if one rabbit has pneumonia, the others could be exposed too. Okay? Any rabbit showing respiratory signs should be immediately separated. Pneumonia or not. Yeah, you're so cute. Have separate bowls, separate bedding, wash your hands between handling animals. Always handle the rabbits that are in quarantine last, so you don't accidentally bring the bacteria from the quarantine to the healthy guys. So in the order of who you're caring for, sick animals come last. If you can, keep new rabbits in quarantine for a full month or more, 30 feet for 30 days, before introducing them to the main herd. Okay, 30 feet for 30 days. That means you quarantine 30 feet away or further from your main herd, and you do it for 30 days, and you continue caring for those rabbits last. Wash your hands after, change your shoes, make sure you are not bringing that bacteria to your healthy animals. It's not a good idea. You don't want everyone to get sick. And remember, if you breed or raise rabbits for meat, wool, or sale, this is even more important. A respiratory outbreak can wipe out your whole operation if you don't act fast. Okay, not to mention, you might lose somebody as cute as this little twig. Yeah, you might lose little twig. And that would be very sad. We don't want to lose little twig. Twig is one of our favorites. So you gotta be on top of it if you don't want to lose your operation or your special little fuzzy friends. So how do we prevent pneumonia in the first place? It's not always preventable. Sometimes a respiratory problem will develop into pneumonia no matter what you do. But there are some things you can do to lower the risk of respiratory infections and pneumonia. First of all, ventilation. Keep your hutches and enclosures well aerated. Stale, damp air is the enemy. Okay? It is better for your rabbits to be cold and dry than warm and wet. Okay? You want that air circulating. They can deal with the cold weather. They can't deal with the dampness in the air that comes by completely enclosing everything. So keep that air moving. You want to keep everything clean. Remove soiled bedding regularly, and don't let ammonia build up from urine. Okay? Keep everything nice and clean. You want to keep things at a fairly stable temperature. Sudden shifts in temperature can really stress a rabbit's system. So put up wind blocks. So you still want to make sure that ventilation is there. But put up wind blocks in the winter so they don't suddenly get hit by a bunch of wind. Hi, buddy. Hi, sweetheart. And you want like shade cloths in the summer just so they can get out of the direct sun. It's not that they can't handle like a cold winter. It's that a cold winter with the wind blowing right in your face is not great. So try to keep the wind off them. Try to keep the sun off them. You want to minimize noise and stress. So no loud noises, no rough handling, no overcrowding. Stress weakens their immune system. So you shouldn't have 10 rabbits in an enclosure built for 4. Okay? Keep your numbers appropriate so nobody gets stressed in fights. You want to watch for the early warning signs. If a rabbit sneezes more than once or twice, it might be more than just, I got some hay dust in my nose. Start watching closely. Don't ignore the small symptoms. Get to them fast. That way they don't erupt into full-blown problems. And finally, regular vet checkups. Here we like to have the vet come out because we use a farm vet. And I like to have him look at our rabbit area and recommend any changes so that we can keep them at their healthiest. But if you've had respiratory issues in your herd before, it's even more important that you have a vet evaluate your rabbits and maybe even evaluate your setup. So don't be afraid to have a vet come out or an expert come out and help you figure out what you can do to do things a little bit better for your fuzzy friends. So I can tell you that we have dealt with pneumonia in the past. Pumpernickel. This was a while ago. Pumpernickel's not on the channel. It was quite a while ago. And so it was before we started filming. But Pumpernickel, I can tell you about one time he came down with pneumonia. And it was really touch and go. Okay? He was at the vets. He had to be admitted to the vets. He was on nebulizers, oxygen treatment, the whole 9 yards. And it was really important that he get that treatment. And he recovered. And he was fine for years after that. But yeah, it was touch and go for a while there. So if we hadn't got him to the vet when we did, he'd have been dead. So definitely treat early, treat quickly. And I mean, we have had instances where somebody sneezes and we kind of overreact and we call the vet and it turns out they just had a little bit of hay dust in their nose and they were fine. But I would rather overreact than underreact. So deal with things as best you can when they crop up. Okay? Hi. So here's what I want you to remember. Pneumonia can follow even a minor cold in rabbits, so it can crop up no matter what. Breathing trouble and blue lips are medical emergencies. Treatment takes time and consistency. It's not going to be over in a day. You need to quarantine your sick animals to protect your herd. And prevention starts with clean, calm, well-ventilated living spaces. And most of all, trust your gut. If something feels off, don't wait. It's always better to be safe than sorry. So that is about it for us here today at Andersen Acres. Drop a comment below if you've ever dealt with pneumonia or any kind of respiratory illness in your rabbits. What worked for you and what didn't? I'd love to hear your stories. We'll see you tomorrow.